Hi, everyone. It's Dr. Arlene Diamco, the multidimensional MD. I am so happy to be back here live with you to talk about multidimensional topics. And today I'm going to bring it back down to something more physical. And this was by request from one of my patients. You know who you are. Thank you so much for requesting this because it's a very important topic. Um, but anyway, I'm back here after about a month, and it's been retreat season and conference season for me, and I'm really happy to be back live and to be able to bring you these topics because my mission is to bring the intuitive aspects of health back to medicine in practical and tangible ways so that we can experience deeper healing in our lives and experience more peace, love, and joy in our everyday lives. So today's topic is on ibuprofen and NSAIDs. I've talked about cannabis use last time. I talked about Tylenol use or acetaminophen a couple episodes ago, and now I'm going to talk about ibuprofen and what are called NSAIDs. So why talk about NSAIDs? It is the most prescribed group of drugs in the world, with an estimated about 30 million people a day are taking NSAIDs. It's also one of the most reported in terms of adverse drug reactions. About 25% of all adverse drug reactions are reported with NSAID use. So that's really significant. So we're going to go through what are NSAIDs, what is ibuprofen, examples of them, and benefits of NSAIDs, and even lesser known benefits, as well as many of the risk factors. We're going to spend most of the time on the risk factors. And this is an exhaustive topic, but we will get through some fundamentals. This podcast episode will be a little bit longer than some of my other ones because there's a lot to talk about. After we go through the many risks of NSAIDs and clinical effects of them, then we're going to talk about just a summary of the side effects to look out for, contraindications and precautions, what else you can do besides taking an NSAID, and then wrap it up with some multidimensional considerations, because after all, this is the Multidimensional MD podcast. What are NSAIDs? NSAIDs or an ibuprofen is a kind of NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs. They work by blocking two different enzymes, the cyclooxygenase enzymes, which inhibit the production of something called prostaglandins and thromboxane A2. These are hormone-like compounds that are synthesized from arachidonic acid. Arachidonic acid is a fatty acid found in cell membranes. And so basically, it inhibits the arachidonic acid cascade that then produces these compounds that have many effects throughout the body. And we're going to go through some of those effects. So there are three categories of NSAID use. NSAIDs that block they're both COX-1 and COX-2 enzymes. So those are the two enzymes, and those are called non-selective NSAIDs. Those include the common ibuprofen, which is under brand names Advil, Motrin, Midol, naproxen under brand names Aleve, Anaprox, or Naproxen, diclofenac, which is Voltaren, ketoprofen, or Orudis, ketorolac, and meloxicam, or Mobic. Then we have the COX-2 selective NSAIDs. I'll talk a little bit more about those in a second, but the common one is celecoxib or Celebrex. And then we have aspirin and other salicylates. Aspirin is known as acetylsalicylic acid. It goes under brand names such as Bayer, Excedrin, Buffering, and it's also in Goody's powder. So what are the benefits of NSAIDs? So NSAIDs, non-steroidal anti-inflammatory drugs, they have three main uses. The analgesic effects or pain reduction. So that can be used for all kinds of aches and pains, from muscle aches, sports aches, injuries, arthritis, dental pain, menstrual cramps, headaches. Then we have the antipyretic effect, which means to reduce the fever. They tend to work faster than Tylenol or acetaminophen, but they have their own host of different effects. And I talked about Tylenol acetaminophen in episode 230. And then the third main use is for its anti-inflammatory effects. Um, and and that's interesting because that we get a lot broader use there. It can be used for PANS or PANDAS, according to the PANDAS Physicians Network. PANS stands for Pediatric Autoimmune Neuropsychiatric Syndrome, or that syndrome disorder after strep. Uh, a whole host of issues, but it's been shown to be helpful for PANS or PANDAS. And it could possibly reduce the risk of certain types of cancer, such as colon, breast, and lung cancer. And these are not going to be like absolute or broad recommendations, but what they have been found to be possibly helpful for in certain cases, and can be used for a treatment for idiopathic pericarditis. Pericarditis is that inflammation of that wrapping around the heart. It can be used for acute gout flares. It can be used for post-op pain, especially after certain laparoscopic procedures, such as removing the gallbladder, cholecystectomy. Ibuprofen is also used in infants to close what is called a persistent patent ductus arteriosus after they're born. A PDA, that open ductus arteriosus, is a temporary artery that connects the pulmonary artery to the aorta so that most of the blood bypasses the lungs. That's when, before the babies are born. Then after they're born, they're supposed to close because blood needs to go to the lungs so you can get proper oxygenation. So those are the many different uses for ibuprofen. When I do these episodes, it's not all about like things being black and white. We can be really thankful that there is a drug to help those infants out and use for other kinds of things and help to provide some comfort. But we need to be wise about it. So we need to be able to make good choices, which means we need to know benefits and the risks. So we are now going to go into the risks of NSAIDs, because those prostaglandins that are blocked and that are important in pain pathways also have many other effects in the body. So we will go through those individually. First, the GI effects. So for GI protection, and prostaglandins in the body are important for GI protection. So the use of NSAIDs to block that can weaken that protective mucus layer in the gut, can create leaky gut, indigestion, and risks for ulcers and bleeding. NSAIDs have also been found to be a trigger for what's called food-dependent exercise-induced anaphylaxis. Again, if you're not digesting your food properly and then you're absorbing that through your gut, then your body's more likely to react to it, because when you're not digesting and then you have this leaky layer, and then it can trigger other reactions besides that. So to help protect it, then it's best to take with food, so you're not exposing the gut straight to the that kind of drug straight. It's also These effects are also important for bleeding and clotting, or hemostasis and thrombosis, and that's due to the inhibition of the thromboxane A2 production and subsequent platelet inhibition. So platelets help your blood clot. And this is really interesting. So this actually goes along with the GI effects as well. I'm going to read you this quote from this British Journal of General Practice from 2016, and by Abigail Davis. In this article, they say non-selective NSAIDs increase the risk of a GI bleed fourfold, whereas COX-2 inhibitors like the Celebrex with increase the risk threefold. Co-prescription of NSAIDs with corticosteroids increases bleeding risk 12-fold. So taking NSAIDs with steroids increase the bleeding risk 12-fold, and with spironolactone 11-fold. And this is also interesting, selective serotonin reuptake inhibitors, so many antidepressants, by 7-fold. So if you're having any abdominal pain, indigestion, and you're taking an NSAID, ibuprofen or others, and you're on any of these other medications, then just think about like, if what that could be doing, and you want to be able to address that. So it's not meant to scare you, but to be able to give you information so that you can make the best possible decision for yourself and your loved ones. GI bleeds while taking NSAIDs are also more likely to be fatal, with a mortality of 21%. Whereas in patients not taking NSAIDs, so GI bleeds if you're not taking NSAIDs was 7%. So it's a far worse bleed with NSAIDs, and that's because of that platelet inhibitions. Your blood can't clot as easily. Aspirin in particular causes irreversible inhibition until it wears off of COX-1 and COX-2. And so platelet inhibition can last for 7 to 10 days, even after a person stops taking aspirin. And some people are particularly sensitive to NSAIDs, including aspirin and other ones. So even a small amount, I've seen this, and when I was in training, and I was actually at Grady, and someone had just taken this one NSAID, and I think they had had some goodies powder or something, and that one made them have some blood in their stool. Um, and I mean, it's remarkable because some people are more sensitive to it, and the effects can be dramatic. So then we go on to the kidney function and NSAIDs. So kidney function, the um, the risk of impaired kidney function increases with NSAIDs about 1 to 5%. That's a lot of people with any kidney issues. If they're taking that that you can have up to 5% of people taking NSAIDs have result with kidney impairment because of the NSAIDs. So NSAID use in patients over age 65 more than doubled the risk of acute kidney injury in the next 30 days. That's huge. Why does it do that? There's multiple factors. It causes vasoconstriction of the blood flow to the kidneys that's going to be filtered by the kidneys. And it also can like raise the blood pressure by a little bit. And it can put you at risk for what is called symptom of inappropriate ADH, antidiuretic hormone release, which can cause sodium retention, edema, high potassium. It can also decrease the blood flow to the kidneys themselves that supply the kidneys, causing kidney damage. It can cause acute interstitial nephritis, possibly due to hypersensitivity, or it can also cause nephrotic syndrome and kidney failure. And this can happen even days after exposure. So it may not happen the day that you take it. It's important to stay hydrated if you are taking any kind of NSAID. NSAIDs can also interfere with bone and cartilage turnover, so it can slow down the conversion of stem cells to healthy bone and cartilage and interfere with healing. And so it's best to avoid NSAIDs after cartilage repair and other kinds of wound healing. And so if you find you're one of those people that have difficulty healing from wounds, then don't take any NSAIDs. It's not going to help. There's other things that you could do, and maybe we can talk about that another time. The cardiovascular effects. So, prostaglandins also have cardiovascular effects and promote angiogenesis, which is the process of forming new blood vessels from existing ones. So if you block that, then it can have all kinds of effects. Again, the blood pressure can increase with NSAID use by about 5 millimeters of mercury. So that's a systolic blood pressure. And it is known that all NSAIDs, including both the traditional and COX-2 selective NSAIDs, increase the risk of cardiovascular adverse events. Now, aspirin is in a special class on its own because it depends on the individual risk factors, but all of them can increase the risk of cardiovascular events, and all of them can increase the risk of GI bleeds. This is important to know. There were multiple selective COX-2 inhibitors that were actually taken off the market because of multiple effects. including the cardiovascular events, strokes, and heart attacks. So, uh, even though there's new drugs, we still have some caution with them and use them wisely. Sometimes we don't know about their full effects until after they've been in use for a bit. And we found that with the selective COX-2 inhibitors, because several of them were pulled off the market for uh, um, not just the cardiovascular issues, but um, liver events and skin reactions. So they can also have effects on your hormonal function. NSAIDs, again, block the arachidonic acid cascade, which blocks prostaglandins, which are important for ovulation and uterine contractions during menstruation and labor, which, on the positive, is why they can help alleviate menstrual cramps. But there are times where you need to be able um, to have that uterus contract well, and you need you need the prostaglandins for ovulation. NSAIDs, especially ibuprofen, can reduce testosterone in both men and women, and they can lower estrogen through inhibition of enzymes and disrupt progesterone release as well. It's known to disrupt the hypothalamic pituitary gonadal axis, which is part of that. We're just all of the endocrine system is connected. And so when you disrupt that axis, then all kinds of things can happen. You can also blunt the ACTH and cortisol release, reducing response to stress and inflammation. And doing so can also reduce your energy levels overall, not just from the hormonal release, but also from other effects. It's associated with a rise in hemoglobin A1C and type 2 diabetes. So there's a lot going on here. When you're popping an ibuprofen, um, just remember that even though you're taking it for a specific thing and can be helpful for that, whether to reduce a fever or to alleviate some pain, there are many other effects that it has in the body. And we call these side effects, but they're not really side effects because they are still the effects of the medication. Energy levels can also be affected, as I was saying, because of the disruption in the hormones. But some NSAIDs also have anti-inflammatory effects due to its effects on the calcium signaling pathways, which that calcium signaling is important in so many cellular processes, including cellular activation, proliferation, and apoptosis, which is programmed cell death. So the NSAIDs can impair the mitochondria's ability to retain and take up calcium and increase intracellular calcium, that calcium in the cells, which interferes with energy or ATP production and can increase the free radicals that possibly trigger cell death. Fatigue and drowsiness are listed as common side effects of NSAIDs, especially with long-term use. And some of those NSAIDs that have these effects on the calcium signaling pathways include ibuprofen, aspirin, other salicylates, and sulindac. Now, there are also effects in terms of the allergic response because NSAIDs can trigger a mast cell activation. Mast cells are important in the allergic response and respond to IgE antibodies. Um, NSAIDs might have a dual response. So this is a curious thing. So some of these effects are dose dependent, and it has one effect with a low dose and then the opposite effect with a higher dose. That's called a therapeutic paradox. So there's a possibility that has a decreased activation at low doses and increased activation at higher doses. So when these mast cells are activated, then they release histamine and serotonin, and then can lead to this inflammatory cascade. And so, if you, there are some people that are at risk for allergic reaction with any NSAID use, or they have what's called an NSAID intolerance, and that's greater with individuals that have something called atopy or high IgE levels, and that is you might know that if you have asthma or history of hives and or anaphylaxis. Um, Eczema too can have like high IgE levels. So about 5 to 10% of adult patients with asthma actually worsen acutely after taking NSAIDs. That's pretty significant, about a 10 up to a tenth. So a lot of times when people are experiencing asthma exacerbations, they might have a viral infection, or maybe sometimes there's a fever. And so you might be thinking, oh, I'll take an ibuprofen, I'll take some sort of other NSAID. So just keep in mind that, okay, but there's up to a 10% risk of worsening your breathing with taking an NSAID. I don't think that that's common knowledge, and, I don't even think that all healthcare providers, physicians, think about that with when people are sick. So, in terms of a summary of side effects to look out for, allergic reaction, of course, such as itching, rash, or swelling, severe stomach pain, heartburn, nausea, that disruption to the GI tract, or possibly developing an ulcer, unexplained weight gain or fluid retention with that kidney issues. Black stools, again, also bleeding in the gut, vomiting blood or clotted blood, which looks like coffee grounds, blurry vision or ringing in the ears, fatigue, sensitivity light, trouble urinating, severe headache or difficulty speaking, or any other pains, whether in your back, your belly, your head. The long-term side effects of NSAIDs include peptic ulcers, which with an increased risk in the elderly, or on steroids or blood thinners, or history of peptic ulcers, renal failure, and stroke and heart disease. So, contraindications and precautions. Who should possibly avoid NSAIDs? Contraindications means absolutely avoid. So, if you have a history of allergic reaction to NSAIDs, or if you've had recent coronary artery bypass surgery or severe kidney or GI disease, do not take NSAIDs. Precautions include the following. So, there's many precautions, and this is up to you and your physician. Anyone with atopy or high IgE levels, a history of eczema, allergies, asthma can be a risk factor for NSAID sensitivity. Any history of ulcers or GI bleeding or GI issues, Crohn's or ulcerative colitis, reflux, platelet defects or bleeding issues, patients on blood thinners, history of stroke or heart issues, kidney issues, diabetes, liver impairment, for some kids with viral infections due to a risk of what's called Ray's syndrome, Ray's disease, which affects your brain and your liver, which I've heard physicians from a century ago talk about it, and they've actually felt that Ray's was due to the dehydration effects of the viral infections. But it is written in the pediatric literature not to give aspirin to kids with viral infections. Caution in pregnancy and breastfeeding. When you're pregnant, around 20 to 30 weeks can lead to renal malformation, and then afterwards can cause premature closure of the ductus arteriosus. If you are severely dehydrated or are hypovolemic, so again, remember to drink enough water when you're taking NSAIDs. Caution regarding any other drug interactions, so talk to your physician about this. Caution in elderly people above 65 years of age are more at risk for any of the risk factors of uh, the side effects that we talked about. And remember, there could be a need to protect the stomach lining especially if using long term, and to take it with food to help protect your gut if you need to take it. And remember not to use it if you have any upcoming surgeries. So those are a lot. What There is hope though. So it's not meant to be like all black and white again, but to give you some options. What else can you do besides taking an NSAID? There are many things that you can do. You could take a fish oil, which helps to improve blood flow to the joints, protects the cartilages. Make sure it's not rancid because you could get more burping with that. You could keep it in the freezer. Doses for that are about 1 to 3 grams per day. You could take turmeric or curcumin. I talked about this on episode 208 on turmeric. And this was so interesting because it's from Dr. Weil's website. In reviewing some 700 studies looking at turmeric's health benefits, Duke concluded that turmeric appears to outperform many pharmaceuticals in its effects against several chronic debilitating diseases and does so with virtually no adverse side effects. That's remarkable. The Arthritis Foundation recommends one 500 milligram capsule of curcumin extract taken twice daily to help control symptoms of osteoarthritis and rheumatoid arthritis. So, yeah, gosh, when you think about ibuprofen, you think about NSAID, then just remember turmeric. You take a spoonful and mix it, make a beautiful golden milk with it. Acupuncture can be helpful for decreasing inflammation, for helping you through certain kinds of illnesses, for helping with pain. Osteopathic treatment, of course, come see me, can help with various types of aches and pains. Castor oil packs can also be helpful. There are some small studies that have shown some promise for osteoarthritis and rheumatoid arthritis, and when using the packs, it can decrease pain. So there are simple things that you can do with much less risk, and it's all about doing those small things consistently. Steps done consistently can have remarkable results. If you want any other information, then definitely see some of my other episodes, episode 230 on Tylenol and other options, episodes 184 and 217 on bone health. You can also consider an anti-inflammatory diet, an alkaline diet, whole 30 diet. All of those things will help to reduce inflammation in your body in a more natural way. And then lastly, one of my favorite things to talk about are the multidimensional considerations, because really a big part of our health is considering our soul's journey and our priorities in life and what makes us feel good, not just physically, but what makes our soul sing. And those things will help our physical health as well. So consider a few questions like, why is your own body not balancing the inflammation levels? What is that fire in your body that's in some kind of irritation? Like, what is creating that harmful fire in your life? And what is irritating in your life that might need some soothing? The adrenals produce its own steroids. So there are ways to balance inflammation, to reduce high inflammation in the body. Your body can do that, but we need to support it. So we need to think about ways to support the body in its functions rather than just suppressing things that are have seemed to go awry. So what can we do to support it in its normal, healthy function? So consider those things when you're thinking about taking any medications, including over-the-counter medications, including ibuprofen and other NSAIDs and aspirin, because we need to look at this from a multi-dimensional perspective. From a multidimensional perspective of the physical body, meaning all parts of the body working in harmony with each other, what it does to our minds, our emotions, and what our symptoms mean in terms of our overall soul journey. So this was a mouthful. I hope that it was helpful for you in some way. Please share it with anyone that you think could benefit from it. And if you'd like to connect with me in other ways, you can on All Worlds Health on Instagram, All Worlds Health and Pediatrics on Facebook, and my website, allworldshealth.com. You can sign up for my love letters. I send them out about once a week or every other on Wednesdays. And I'd love to connect with you. Please let me know if this has helped you in some way. And if you have any other topics that you would like me to talk about, then um, I will look into that. So lots of love to all of you. Have a beautiful rest of your week. Remember, I believe in you, and I hope that you believe in you too. Bye.